Welcome to my YouTube channel. I'm going to make a self-presentation. I'm Dr. Ricardo Hoogstra, plastic surgeon. I'm specialized in minimally invasive procedures. I'm working with laser technology since nearly 1994. I specialize in periorbital rejuvenation without skin resection. That does mean that from here to here, I improve the tissue, I tighten the tissue, I rejuvenate the tissue without leaving a scar. This is my first presentation, 4 years of experience with Blepharoplasty, transconjunctival and laser rejuvenation. In 2017, I was invited for RISAP's International Society of Aesthetic Plastic Surgeon to present a work about blepharoplasty. At this moment, the work was called Blepharoplasty without skin resection. And I present my personal technique that you can see, and from that time and today nobody is performing my technique. I received the congratulations of the President and Vice President of the International Society for the excellent contribution to the plastic surgery, and also have recognition from Harvard University and Mayo Clinic. My technique appeared in Wikipedia in Spanish, like a minimally invasive procedure for blepharoplasty. Patients around the world come to my clinic, like this patient from Mexico, to operate the eyelid fat pads. I have nearly 2,000 educative videos and 500,000 of followers, and my videos are educative. You can see a lot of this video with this technique. And Manolo came from Mexico to perform a blepharoplasty. I removed this lower eyelid fat pad through transconjunctival incision, this upper eyelid fat pad through a stab incision. I do not remove any skin, I rejuvenate the skin with laser technology, tighten and rejuvenation the skin. My new paradigm is do not remove the tissue, just rejuvenate and tighten the tissue. If this patient is performing conventional blepharoplasty that remove skin here, they are going to pull down the eyebrow, and this patient is going to have a tired, sad expression. But at this moment have a sad and tired expression. I recommend him to perform an eyebrow lift without a scar, and also you can see a lack of volume in the cheek. The eyelid is longer from here to here, it's a long distance, it's not aesthetic shape, but the patient comes only to perform a blepharoplasty. This is the lower eyelid fat pads, this is the anesthetic, the distance of the lower eyelid. This is intraoperatively where you can see the fat pads and no skin. This is a patient 7 days after the procedure and come back to Mexico without a scar and without eyelid fat pads. Now this patient is 6 years later. The patient came to my clinic to perform what I said him 5 or 6 years ago, is reposition the eyebrow and to improve the cheek. Generally, the patient do not understand this topic, but when in the aging process the cheek lack of volume, and we have this channel that we call tear through, no? And also for this lack of volume of the cheek, we have a long distance from the tarsus to the line that is lower eyelid, cheek junction. The lower lid, this is the eyelid, and this is the cheek. You can see different skin. And the lower lid cheek junction is very low, and here we can see a V, a short V, but the ideal is to have a concavity here. Then we can see what I said, the ptosis of the eyebrow, the tear through, the long distance of the lower eyelid, in this position also. And the idea, I developed a technique where I reposition the eyebrow through 3 Mollis incisions that don't leave a scar. I avoid this. This is not necessary. This is very cruel for me. For me, it's impossible to perform a man, a bald man, or a young patient. I operate young patient, bald man, everything with my technique because I have no visible scar. And here we can see the patient 6 years early, and this is in the moment that is going to go into the operating room. You can see the ptosis of the eyebrow, and this is 6 years early. This is 6 days after the procedure. The reposition of the eyebrow, you can see a nice position. Also you can see these scabs for removal of the skin. You can see a nice skin here. This is going to peel off 1 day after. But you can see also, look, a nice cheek, and the lower lid, the cheek junction is very, very slow, very high, and now is very low. You can, the improvement, we are expressive. Our eyes express a lot of a plethora of emotion, tiredness, sadness, and when you have a lower eyebrow, you look sad, tired, and old, because when the years pass, the eyebrow pull down. When you reposition, appear a nice appearance. You are going to see in the world is not performing a lot of this procedure, because in a lot of they resect the skin, they left big scar, and also around the world resect the upper eyelid and lower eyelid skin. And this is not necessary. What happened? Plastic surgeon will have a school of general surgery, reconstructive surgery, aesthetic, everything. But in the world there is not a school of laser technology. I think I was in the right place in the right moment, because in 1994, when this began, I was working with medical doctors, dermatologists from Harvard. Since 20 years, I'm performing this kind of procedure that is very precise. Associated with my ability of performing this procedure is a good combination. You can understand that for me to rejuvenate all this area, I take 40 minutes under local anesthesia plus sedation, and it's ambulatory. The patient I produce less edema, less hematoma. You can see this patient 6 days after the procedure. You can see the nice skin here that peel off, and this is going peel off, and you can see the tail of the eyebrow here, and here the reposition. You can see a fold here, you can see a sulcus here. This is the patient 6 days after the procedure. Here you can see no scars. Also here no scars. And here I have two stitches inside the hair that the patient is going to remove alone in Mexico. The patient is very happy 6 days after the procedure and come back to Mexico. This is the patient. It's not 7, it's 6 days after the procedure. And if you have any question, you can send us an email, a WhatsApp, and we are going to analyze what do you want. And I'm sure you come back to my country directly for a procedure. I hope you enjoyed this presentation. Have a nice day.